Okay, so there will be two questions today. So the first one is UNICEF is leading NGO in protecting children and women's rights. How important is sanitation impacting to children and women's health and living?
Um, Sanitation is a basic service, and I think it is very vital to protect the dignity and privacy of individuals, and especially for women and children. Every day, millions of children and women in this country go out to defecate without and search for a private place for defecation. I think that is really embarrassing for a country like Vietnam, which is already reaching to a middle-income country status. I think therefore it is very important for the country to work on sanitation. If you want to ask me about the health aspect, I can only say that open defecation has got not only affecting the human dignity and human right, but it is also affecting adversely the health aspect. Like most of the communicable diseases like diarrhea and worm infections are coming from poor sanitation. And a woman, a adolescent girl who is ready to be a mother, or a married woman who is ready to be a mother, when she is not carrying a good health because of the poor sanitation around her, she cannot conceive a healthy baby, and she cannot deliver a healthy baby, and that affects the next generation as well. So when a child is born, many times you see that the child dies, and most of the causes of the death are basically the poor growth of the child inside the mother's womb, and that is basically a contribution, those adverse contributions are basically for poor sanitation. The second aspect is, even if the child comes out and tries to stay healthy, because of the infections around the child and the frequent bouts of diarrhea the child gets stunted. The height of the child doesn't grow as much as it should grow. And I think it is a serious concern for Vietnam, because 20% of the children in this country are stunted. It is one of the most known country to have high level of stunting, despite it has got a middle income status. So therefore, I think it is important for the country to work on sanitation.
Thank you, Mr. Lalit. The second question is, what is the biggest ambition of UNICEF to improve sanitation and hygiene in Vietnam until 2020?
UNICEF has worked with the government of Vietnam very, very closely, and we have jointly drafted a statement of commitment for sanitation and water for all to eliminate open defecation in this country by 2025. That's probably a little more than 2020, but our ambition is always to make it as soon as possible. And to make this happen, UNICEF has further worked with the government to last couple of years. We have worked with the government to establish good models for community mobilization, where the community leaders can take a role in mobilizing their own communities to stop open defecation and to go for at least some basic sanitation, which doesn't cost much. I think this has been successfully proven working in this country, at least in the 7 provinces where UNICEF is providing direct technical assistance. Having said that, this is not enough. This is very good start. This has already demonstrated good level of confidence within the government partners that they can manage to deliver something like this with the community mobilization. But it requires huge amount of change. It requires change in policy to make this system completely enabling environment for the communities to handle it. Then also it requires huge amount of investment in the skill and capacity development of the province and district level staff. It requires additional resource in terms of finance, basically for government to invest in sanitation promotion. To make this possible also, we have recently started working with the World Bank to make sure that a good package of money can come to the government of Vietnam along with the technical assistance, so that this effort which UNICEF has done in 7 provinces can scale up to much more number of provinces where the sanitation coverage is very low. So I think we are hopeful that this kind of support which is coming from other sources, UNICEF and government of Vietnam can jointly work and to help the poorer communities to be open defecation free. The key is of course the lowest quintile population and the people who are staying in hard to reach locations, and our ambition is to basically to see that those sections of communities are addressed, those people are mobilized, those people get low-cost solutions for sanitation so that they can afford to build latrines for their home. I think this is quite possible. Although we hope that this will be achieved by 2025, sooner is better. I think Unilever's support in this area has been magnificent. Actually, I would certainly say UNICEF globally and UNICEF nationally in Vietnam, they have been very much committed to the sanitation agenda, and they are always inspiring, and also financially they are supportive to UNICEF in helping us to come to a status of zero open defecation. I think that's a great goal, and the organization has been very committed to their corporate social responsibility to sanitation.
Thank you. For the interview today, there will be two questions. The first question is, UNICEF is leading NGO in protecting children and women's rights. How important is sanitation impacting to children and women's health and living?
I think sanitation is a basic service, and which every human being need to have and need to access to. Sanitation protects human dignity and also the privacy. Therefore, it is important for any country to ensure that everyone in the country has access to basic sanitation service that provides basic healthy environment for defecation and also provides the right kind of privacy for them. Every day, millions of women in Vietnam face this crisis. They face the crisis because they don't have a latrine in their home. They have to find distant places where they can go and defecate open. I think this is the same for a country like Vietnam, which has already reached middle income status. Probably we need to work together on this and make sure that the situation change as soon as it possible, and it is doable. The government of Vietnam is extremely committed and they have the intentions to make it happen. Coming to the health aspect of sanitation, open defecation often contributes to frequent instances of diarrhea amongst the people and also leads to worm and helminth infections. And these infections and frequent instances of diarrhea practically leads to unhealthy human beings. This is much more precarious for women who basically need to stay healthy because they also become mothers. When an unhealthy adolescent woman gets pregnant, the child she delivers is not healthy enough. So the child gets infections and often even child dies. And the child who survives also gets to other kind of problems like this kind of infections because the surrounding is full of helminths and diseases and infections. Therefore, you will find often the children get into frequent incidences of diarrhea and worm infections, and that leads to their growth stunting. It is unfortunate that in Vietnam, 20% of the children are stunted, and this is a result of poor sanitation. Thank you.
So the second question. Can you please tell me what is the biggest ambition of UNICEF to improve sanitation and hygiene in Vietnam till 2020?
Well, this year we worked with the government of Vietnam to help government of Vietnam to make a strong commitment at Sanitation and Water for All, a global forum, to stop open defecation in the country by 2025. Of course, it can always happen before 2025. It can happen by 2020, but that requires huge amount of investment, huge amount of motivation, commitment from the much higher level, starting from the Prime Minister, President to the various leaders. So it is quite doable, and we are working with the government towards that commitment. What we have done before this year is basically helped some of the provinces to demonstrate community mobilization approaches to sanitation. And these sanitation programs has explained that if the community leaders take the initiative, they can motivate each and every household to stop open defecation, to build latrine and use latrines. They may be very low cost latrines, but that helps in stopping open defecation. Now, in our 7 provinces where we are working, at least there are villages where there is no open defecation. These are good demonstrations to be scaled up. We have started working with strong partners like World Bank who have the commitment for sanitation as well, and they are willing to support the government of Vietnam with some kind of soft loan to invest on sanitation that will in turn help in arriving at open defecation free Vietnam. The ambition is 2025 to the external world, but Vietnam can always make it maybe much earlier if there is a strong commitment from the higher level. And we are looking forward to achieve that by 2020 to an extent, at least to very close level by 2020. And I must say that Unilever as a partner has always stood beside us and has been very supportive to financially and also other way around to help Unicef to demonstrate this kind of models which are now ready to scale up. And Unicef has Unilever has the commitment to continue this support further. Unilever as a partner globally and also nationally, I think is very much committed to the sanitation agenda as their corporate social responsibility.